Okay, so ABC method instructors, thank you, Erica, for being able to come in live. I know I changed the time on you. I know that it's never easy to make things work. I just had a nice little one-on-one with Erica. If you missed tonight, and if you have missed time with me and these questions have come up for you, like you've got pregos and you've got postpartums and whatever, you can always message me to get on one-on-one time, because I would rather one-on-one time with you than not feel like you have the answers to the questions as they walk in your door. So please keep that in mind. But today we're talking about pregnant people that come to a regular fitness class. So if you're teaching a prenatal fitness class, it can be very easy to just lead a prenatal class. But if they come to a regular class, then there's just a few things that we need to keep in mind. And for me, just so you know that this is like my lens and how I see things, I don't differentiate like first trimester can only be here and second trimester can only be here and third trimester can only be here. Reason being, every body is different. Literally, every body is different. And some women that have come to you will be on their first pregnancy and some will be on their eighth. And those are very, very different bodies. And different women carry differently. And different women are struggling with different aspects of their pregnancy, which they might or might not tell you. Okay. So here's a few like general things that I think about when they come to class. Number one, as soon as they start showing or they are ready to tell you that they are pregnant, that is when they stop laying flat on their back. So that's when you can start using your incline bench when you're doing things on the floor. But you don't want them to lay all the way on their back, because it actually does crush a major artery that goes to the baby. And so that's serious. And we need to make sure that we have at least a little bit of elevation when we start showing or when we start saying that we're pregnant. That's also the time that we stop doing general core work. So the same things that we taught about postpartum, the sit-ups, the full planks, the pull downs, the weighted twists, all of those things we need to stop when they're showing and or when they tell you that they're pregnant, because it's a lot of undue stress on the core that could cause extra issues with diastasis and pelvic floor. Do we want to help them if could already be present? We definitely don't want to progress a problem that could already be present. So we're going to err on the side of something a little more useful. Okay, so what is useful in pregnancy? We do need supportive core muscles underneath to hold the belly up. So, and depending on how strong or how lax or how stretched those muscles already are, the belly could start to feel like it's falling down and falling out for different mothers. I always tell them, feel free to wear a supportive garment to class. A supportive garment is not the same thing as a waist trainer. Make sure that they know and understand that. Those waist trainers that are like girdles, no way. No, we don't do that to pregnant moms. We don't do that to anybody, but especially not pregnant moms. But we can wear the very simple belly band, which is just that like simple nylon layer that you can wear under the belly that just gives an extra layer of support. And my favorite one is the prenatal splint made by Recor Fitness. That's a really nice support. And even into the third trimester, when they might feel like they're really sticking out there, that prenatal splint can give them enough support to be able to get through their workout without that feeling of like they're falling out, or the pain in the lower belly, or a lot of this on the bladder and the pelvis, because that's what's happening too. I mean, the gravity is pulling down on that baby, and that baby is sitting heavy on that pelvis. So then we end up with pelvic floor pressure, pelvic floor stretching, and then pressing down through the organs, which is extremely uncomfortable in life, but especially while you're trying to get your workout in. Okay. Another thing that I start to veer towards, like maybe not right as soon as she says that she's pregnant, but maybe as we start to progress a little bit more, that we start to go into more low impact. And I'm not saying that that is for every mom, but I want you to give her the option of low impact pretty shortly after that, because a lot of times high impact again has that jarring effect on the belly, and it can be pulling on the lower abdomen, and it can be very uncomfortable for one, but for two, those abdominal muscles are going to have a harder and harder time holding the weight when there's the added pressure of the high impact exercise. I do know mothers that have been perfectly fine going all the way through their pregnancy without ever going to low impact. But that is, I would say, the mom that has a long history of understanding her own body very well and knowing what it should feel like. So just like I was telling Erica, the gauge is always the internal clock. How are you feeling about this from the inside? Do you have pressure on your pelvic floor? Do you feel like your belly is pressing down and out? Well, you know what? We can take another option here, because if it's painful, or if it feels like it's opening the muscles or pushing on the pelvic floor, that is a health issue that we don't want to have now or post birth. So we can have another option. We can have a low impact option. We can have an option where we're on our knees, on our side, whatever the exercise is, we can take the option. Okay. We don't want anything to be super stressful on the core, like I was saying, because almost all pregnancies end in a diastasis. I mean, it's just the honest to goodness truth, but we don't want to exacerbate something and make the recovery more difficult. We want to make it easier for her to feel like herself again and to be able to get back into exercise again. There are old school verbiage, words that were out there back in the day, and it was even in my prenatal certification, it was kind of silly, that said that you should not let a prenatal woman get above 140 beats per minute on her heart rate. Now, you're a trainer. Could you ever look at any human being and not know anything about their body or their history or their resting heart rate and just give them a blanket number? That's silly. So that one I would not worry about. Here's what I would worry about. When a woman goes into anaerobic, meaning that she is breathless, she's gasping for air, the body is going to give whatever remaining oxygen is left to the baby. That's how we're built. So that means that she is likely to faint, pass out, or have a seriously hard time catching a breath. So at the point where we're talking about pregnancy, we might want to talk about not going all the way to the anaerobic state. We might want to stay at the aerobic state, which is raising the heart rate but still being able to talk. I like the talk test because if she's talking to you, then she's got enough air to go through her vocal folds. She's able to talk to you. And if she's got enough air to talk to you, then she's got enough air for baby. If she's struggling to talk to you, then you don't know what else is happening up here, and therefore you don't know what is happening down there. And we definitely don't want a woman passing out on our clock. So be aware of that.
Yeah, when we're doing an endurance style workout, I normally give them a scale of 1 to 10. 1 being you're not really moving, you're not doing anything. 10 being you cannot catch your breath. And so we're trying to stay at that level 6, level 7, where you're breathing a little bit heavier, but you're not out of breath. You're able to talk, you're able to communicate, you're able to carry on a very small conversation with a few words.
Yes.
And I usually try to use that as a range, even for my preggers.
That's right. Very good. And speaking of being breathless and things going to your head, the arteries in a pregnant woman continue to expand throughout pregnancy. And at some point in her pregnancy, they will expand to the point where sometimes the heart has a hard time getting blood to the brain anyway. Okay, so that's when we really need to pay attention to that level 6, level 7, which might be a lot less from where her level 6, level 7 was in the previous month. It can change suddenly. And she might not even be aware of it until she comes to your class. And then she's like, oh my God, last time I could do, why can't I do this anymore? And it's like, your body is changing, your vessels are blooming, you're getting all of these things ready for baby. No worries. You're still doing amazing things and you're able to give nutrients to your child. So don't even worry about the fact that you're walking and everybody else is running. Just do you. Just do you, and be safe about it. And then there's the whole joint thing. The joints get super relaxed. The further on into pregnancy you go, the looser they get. It's called relaxin. And so actually women that are pregnant can overstretch. Be aware of that. Like if all of a sudden they can kick way over their head and that wasn't normal for her before, that it's like, ooh, we might be able to overstretch at this point. So when we go into flexibility, I'm going to ask you to not go completely into the splits because that your body might not like that later. You might actually overstretch an area of your joint and then we'll have to recover from that later. It could become a problem later, even if she doesn't even recognize it now. And so sometimes with general exercise, she'll have a larger range of motion than she had before. But if it looks strange, like if her elbow is bending backward to get into this extra range, then no, we're going to come back to something that is safer. Just be aware of that. Then be really aware of the pelvic floor and the pelvis itself and the bones around the pelvis. So the bones around the pelvis with that relaxed and with the fact that she's about to give birth, the whole pelvis gets loosey-goosey. And so as it ebbs and flows, and this might be painful, it was for me, might have been painful for some of you, as it gets loosey-goosey and you have that whole expansion happening and strange things happen with the hips, sometimes the mobility becomes hypermobility, or she might have a more difficult time controlling her lower body mobility. So all of a sudden she might feel like she's losing her balance, which of course might be a gravity issue too. But all of a sudden things might just feel wrong in the pelvis. And if that's the case, make sure that you do things bilaterally. If she's supported with both legs, she's more likely to have success and proper range of motion than if she's one leg out, one leg in. And I've told a couple of the classes this, and I want to make sure everybody knows this. My physical therapy friends have requested that you understand that walking lunges themselves are really damaging to the pelvis and the pelvic floor during pregnancy and postpartum. And I know that you love them, and I know that we all love to use them because they're so efficient and so effective with legs. But if you will turn that pregnant mom to the side and have her do walking squats, that would be better for her pelvis. I hope that makes sense to you. Double leg deadlifts, double leg squats, things that she's supported with both legs, but not in the split stance just because of pelvic floor issues. Wanted to make sure that I brought that up. Those are the main points of pregnancy that I wanted to talk about. I'll talk to Erica for a second and see if any questions have come up for her. And then if you're watching this later and I haven't addressed something, please make sure that you ask below so that I can address it in an addendum or in another video. Another thing I did want to mention is when we get really pregnant, arms over the head can also make that that breathless, headless, like dizzy feeling. So sometimes at some point, you need to just keep it at the shoulder and below, just like we do when we're in postpartum, just when we're doing that postpartum recovery. So keep that in mind as well. And of course, like anything in ABC, what are we looking for? We're looking for alignment, breathing, and in this case, core stability, because at some point, finding the core and engaging it becomes really, really hard. But just a level of stability to where she doesn't feel like she's falling out is the goal. Alignment is a super big, important goal. And I think I've told most of you, I've had clients actually recover most of their diastasis during pregnancy. If they had one from before, they were able to recover a lot of their diastasis during pregnancy just because I was hyper-focused on their alignment. And I said, that's all we're going to think about. We're going to breathe, obviously, but we're going to think about that alignment for the next 9 months. And most pregnant women start rolling forward when they're pregnant. And if they don't do that, it takes so much pressure off the core. The rib cage doesn't push down into the belly. And a lot of times we can fix that anterior pelvic tilt that happens so much in pregnancy, and the shoulder doesn't get stuck forward. And those elements make a huge difference in their recovery because they're not stuck there postpartum and then trying to recover from that. So alignment is huge. Breathing into the lungs is huge because at some point she's going to feel like her lungs have been taken by an alien. And just being able to breathe into your full lung is empowering and helpful. So that's super important. But then the core stability, just feeling stable and lifted in the core muscles and not strained in the core muscles is a major, major goal. Okay, I've been blabbing on for a while, so I'm going to stop here. Erica, is there anything I left out or any questions that you have about these topics for pregnant women?
None that I can think of right now. I think it's been pretty thorough. I'm glad that you brought back up when they reach that point that they're saying that they're pregnant or they're showing to take planks, strict planks out or regular planks out. Because a lot of times I see people go directly to a plank for a pregnant woman as opposed to an exercise on their back, not thinking about the fact that gravity is naturally going to pull that belly down in that full plank position. So I'm glad, I appreciate that reminder for even for me.
Yeah, you're right. It's too easy to just pop a woman in a plank, and it's not necessarily going to benefit her during pregnancy as much as just some basic stabilization, just basic breathing and stabilization of the center of the body is going to do her a whole lot more good, either from sitting or from all fours or from standing. Basic stabilization. I love doing sitting exercises for my pregnant women because they can usually sit on the floor very well. They've got the nice loose joints and they're ready to sit all the way down on their pelvis. And so we can like use all of our levers around the seated torso and get a lot of core stability in that way. So we can have that as an option. Was that all, Erica, that you thought of?
You know, I hadn't even thought about the lunging during pregnancy, but it definitely makes sense. I can remember when I was pregnant that I struggled with lunges. It was uncomfortable on my pelvis, just the way that you can't, it's hard to stay in alignment here when you've got this weight in front of you, whether you're doing a reverse lunge or a forward lunge.
Yeah.
So that definitely makes sense. So you said lunges, static lunges, obviously traveling lunges. What was the other one you said though? Single leg deadlifts, which I very rare. Yeah, I wouldn't want them to be on one leg in general.
No, and as you know, just balance exercises in general, they have to be able to put their hands on something because you never know when they've lost that equilibrium a little bit or the gravity has shifted a little bit and they could lose their balance. So if you are doing any kind of balance training, at least have something close by that she can grab, a wall, a fence, something. So yes. All right, well, this was fun, Erica. Thanks for visiting with me this evening.
Thank you for offering this. I definitely appreciate it. This is good.
You're very welcome. I'm going to stop the recording here.